credible jobs that they're looking to fill immediately, right? They need people all over the country. They're high paying jobs too, like really high paying. So I don't want to take too much time because I know Andrew's excited to get on and talk to you guys about Flosonics and FlowPatch and what they're all about and the culture at their company, their vision, and the types of people they're looking for. So Andrew, welcome back. Thank you for being here again, and excited to have you, man.
Yeah, hey, thanks for having us again. Tried to get a day that wasn't a Friday this time, and also today on the call. I'm not sure if you can see, there's a lot of people on this call today, which is awesome. But we've got our director of HR who's joined us. Just thought it was a great opportunity for a lot of the questions that came in last time that people might have. So we've got Ben Dales, there he is, on the call today. So Ben and I are going to kind of tag team it today, and hopefully be able to inform everyone. I see there's another Andrew E on the call, so that's actually my same initials. So don't see that very often. If I've got my screen up here, can you confirm,
You're not
Tyler?
sharing. You're not
You're not
sharing
sharing,
yet,
Andrew.
Andrew.
Oh, sorry, I had to send a request to share. Apologies. All right. Okay, so really quickly, the introduction, our company is, kind of level set for at least for the next year. The positions that we're looking to try and fill through this program are uh, mostly in the clinical realm. So for people that have clinical training, such as nurses, physicians assistants, medics, coursemen, those types of positions, we will have a lot of those types of jobs. And what we do is introduce our new medical technology to hospitals to care for critically ill patients. So our device is a small wearable ultrasound patch that goes over the carotid artery, and we use this to help guide management for critically ill patients. So a lot of the positions that we're looking to fill are, as I mentioned, clinical facing. So this would be training other nurses, training and implementing this technology at hospitals in the United States, across the US. So maybe a quick question for the group here, but are people using the job board on the platform, and is that people looking for jobs through that mechanism? But we've got a job posting up right now that is all over the US. So we're hiring in every geography in the US for these types of roles.
Hey, let me help you out for a second here, Andrew. I don't know how much time you spend on Zoom, but I spend more than I want to admit. Do me a favor, class, if you guys wouldn't mind, throw a 1 in the chat if you've got clinical experience, and throw a 2 in the chat if you're checking our job board daily for open positions on there. So we've got some clinical folks on the call, and we've definitely got some people that are viewing the job board. In fact, and it's going to show up different on each person's computer screen, but there's a job on there. Actually, do you mind if I take your share for just a second, Andrew?
Yeah, that'd be awesome.
Just
Yeah,
want
really.
to just want to highlight this on the screen really quick. So if you go over to our job board, let me hit share there. You guys see my screen?
Yep.
So for me, it's on page 5 of the job board, but you guys, it might be on a different page for you, but it's called Clinical Optimization Specialist, multiple geographies, meaning, all over the country. And look, they're looking to hire 5 to 10 folks. And here's the job listing. So if you guys want to go check this out, this is what Andrew's talking about. So I'll give you your share back, Andrew. I just wanted to show them on the job board what that looks
Yeah,
like.
that's super helpful. Yeah, we haven't had any applicants yet, so we're really keen to get some people coming through this. If you guys weren't aware of, that's why we're here today. So maybe we'll just quickly finish off just highlighting the company, the technology, and then open it up for any questions. So for the people who answered 1 in the chat, small wireless wearable blood flow sensor. We use that to manage hemodynamics or essentially optimize patients during resuscitation. It's a small device that goes Bluetooth to an iPad, and we basically enable critical care ultrasound for all users and make the workflow fast, simple, and easy. What's pretty cool about our technology is that we were awarded Digital Health Awards Best New Medical Device in 2024, and we're getting a whole bunch of really strong customers signing up. And a really exciting part of this DoD Skills Bridge program in our past relationship, we've been working with the DoD for the past 8 years in developing dual use applications for our technology. So we are in active collaborations with the US Army, US Air Force for adapting this technology for combat casualty care and military specific operations. So we have a dual use technology, and we have those relationships and those projects. So we are actively in multiple different Veterans Affairs hospitals being used in routine care. And as we expand across the US, we hope that people on this call can join us in introducing this new technology. Sometimes these positions get to go to conferences and meet with nurses and try and attract and inform the market and hospitals that we have this new technology that exists. So, here's a great example from last week in New Orleans. Some of our commercial team and our nursing clinical optimization specialists going on site for a 3-day conference, meeting nurses, getting energized, getting new leads to new hospitals so that we can go in there and introduce them to technology and ultimately have them start integrating it into their care pathways. Maybe I'll stop there if there's any questions, Tyler, and Ben is also here to help with any HR related questions as well.
One thing I did want to say before we jump into any questions there is just reflecting back on to give you guys an idea of the size of our organization and our path. I started with the organization with Flosonics about 3.5 years ago, and I think we were probably close to about 25 employees. Since then, the team number is actually closer to 66 now, which is really exciting. We are in multiple geographies across the United States, from Florida to California to Illinois. I won't try to name them all because I'll definitely forget some. Our team has grown considerably, and they're doing a lot of really great things. What we are looking for is people that are passionate about improving patient outcomes. It's our core value, and that's what we do. And then people who are sharp. I'm still looking for a better word than sharp, but that's what I'm going with now, is like people that are passionate about improving patient outcomes and people who are sharp in their discipline. The clinical optimization specialists, or the COS as we call them, are typically, have worked in an ICU or in critical care, and are now had transitioned over into industry and are in the hospitals working with providers and clinicians and nurses to educate, help people understand what they're reading in terms of the metrics that come up on the iPad, and making sure that they're know how to use the technology properly, that they're there top of mind, can answer any questions and help drive utilization so that patients are getting the best care. Andrew mentioned, oh, sorry.
Most of the departments that we're in hospitals are emergency departments, ICUs, post-operative surgical units, rapid response teams. So, the kind of, I think we're looking for any nursing background we can train. It doesn't have to be ICU, but the majority of these types of patients that come into the hospital generally come through the emergency department, and they end up in the ICU later. Sorry, Ben.
Yeah. I think that's pretty much it from kind of our company background. But I mean, to talk about our growth path, is we do have a pretty aggressive growth plan for this upcoming year in terms of new individuals and new headcount that we are looking to fill in a couple of the different major geographies. So if it's something that you're interested in, please apply. The jobs are typically posted on our website as well. And I think I saw a couple of LinkedIn connections come through, so feel free to connect. Maybe then just going back to Andrew's point there, was there any questions on the technology, the team, anything that we can do to provide some more information?
Yeah, you've got 2 questions, or now you got 3. Temperance, what's your question?
Hi. Does I guess my question is, so is the role more of patient education um or more clinical?
Great question, Temperance. So the clinical specialists work with the nurses and the clinicians on site to make sure that they understand, how to properly use our FlowPatch, the medical device.
Okay, so it's a little bit more of patient education, even though it's not really like hands-on as much as like clinical, like going there, doing with the nurses and stuff. I know like helping the nurses understand, not really putting putting it on the patients and things of that matter.
You'd be training the nurses how to do that, so it has nothing to do with the patient. It's all provider and nurse to nurse peer-to-peer
Mhm.
training and workflow training.
Okay, thank you.
Yeah, exactly. I can't see the question, so I'm not sure if there was another
Oh,
one
my
through.
apologies. Yeah, you've got Michael Kelly. I'll try to call these in order.
Thank you.
Yeah, thank you guys for coming on. This is interesting. I've only seen a couple like wearable devices like this coming out in the mass media. Diabetes, of course, being one of the main ones. The new sleep apnea, although I'd say that's more surgical than just wearable. And so seeing something like this that can do this kind of good for people is really exciting.
Mhm.
Now, the question I have isn't so much on the clinical side, um, but on the technology side, and more on the I guess the government compliance side, because obviously there's a lot of personal information being uh, um, transferred between the device and your servers. And my question is, one, uh, how big is your team of folks that are one analyzing the regulations to make sure, and then two, um, are you growing in that area?
Thanks for the question, Michael. Actually, we don't collect any PHI, so that the regulations on that, we just follow the FDA's cybersecurity guidance in our medical device manufacturing and quality system. So it's not a problem for our business right now.
What about any payment collection? Because that also falls under the PCI DSS regulations.
Sorry, we work with hospital procurement departments. I'm not sure it's relevant to this position or our current needs. Thanks.
Okay.
Dante, what's your question? Dante had his hand up.
Hey, yes, I did. Sorry, my bad. Good morning. Good morning. I didn't get a chance to look at the advertisement. However, I know that Sutter is definitely big in the West Coast. I don't believe, correct me if I'm wrong, if you guys said a location. Basically, my question is, does this position allow for travel? Is traveling from West Coast to East Coast, or is this individual going to be homesteading in a particular location?
Yeah, great question. I think what our approach is right now is when we are hiring clinical specialists, they're typically in the geography that we are servicing. So, let's say the Bay Area, you would go to the hospitals that are in that general geography. There is opportunity for travel. I know like our team will, let's say go to New York to support an evaluation and a launch if it's required. But ideally, we're hiring people to be in the geography that they're going to be working in, so that they can continue to build those good relationships and be on site often. But that's kind of our plan.
And Dante, it's a great question. When we were starting out and we didn't have a lot of hospitals and accounts in regional geographies, then it was a lot more cross-country travel. And now that we've been fortunate, so this other example is, there's 26 hospitals in Northern California. It's a highly concentrated area that someone in that region can go service. We're also opening up hospital networks in New York with Mount Sinai, in the Midwest with Advocate, down in Florida with Advent Health. So we're sort of getting these more regional pockets of places for people to spend their time. And there's still travel involved, but it's ideally it should get less across the country travel and more regionally focused.
Oh, perfect. Thank you. Yeah, you guys answered my question. Yeah, Sutter. I know Sutter grew up in Northern California, Santa Rosa to be
Yeah,
exact.
nice. Yeah, we're in Sutter, Santa Rosa. Yeah.
Oh, really? Oh, okay. Good
Yes,
stuff.
sir.
But yeah, thank you. Appreciate it.
Keaton, I think, was next.
Hey, good morning, Andrew and Ben.
Hi.
So my question was, what specifically about this job and this position requires prior, nurse or medical field industry knowledge? Just, and the reason I ask that is because I'm sure that there's a lot of people specifically on this call that have spent, a decade or two training people. First of all, that's one of the biggest things that we do in the military is training others. My time on the Nimitz, I would get fresh 18, 19-year-old, kids in essence, and train them on how to operate a $5.5 million aircraft engine component test stand. That's very dangerous to operate, requires a lot of technical knowledge. But I guess from my standpoint, I know that there's a lot of people in this call that if they had a 2-month course or training within the company of how FlowPatch or sorry, I forgot the name of
You
it.
got it. You got it.
Yeah, just if they understood how it operates, how it works, what metrics it's following, and stuff like that. I believe that a lot of people could go into this industry and train, nurses, and a lot of them have, sure, there's, soft skills that people need, but I guess my question is just, I've never worked as a medic or in the nursing field, but a lot of the skills that you're looking for as far as like training nurses, working alongside, if I had like a month or two to learn the product, learn how it works, learn, how to properly train these nurses and other people that are in the field, like I feel like I would be able to do it really well. So I guess it's almost just, to me, I'm wondering what specifically about the job makes it where you're specifically looking for people with prior experience in that field. I hope that makes sense.
It makes total sense, Keaton, and thanks for the question. I'm sure Ben has interviewed hundreds and hundreds of candidates for these roles, and I think as we get more operational, that version of the role where there's maybe less clinical engagement and peer-to-peer teaching as part of the initial sale and implementation, and maybe more of like account management, going in, making sure that they've got inventory, making sure that all of the hardware is in a good spot. So think of it more of like a clinical operations type of role as opposed to a clinical specialist, where there's just a lot of stuff to do. And
Okay.
and so you could think of it like it's something that we're currently evaluating is do in the best case scenario, you've got an ICU nurse who's taking care of these patients and knows the ins and outs of everything, and then the delta between those things that we're trying to understand. And I think this is to your point, is what's the minimum skill requirements that we could train someone and have them be productive in the role.
Right.
So that's a really great call out, and something that I think we can walk away from this call thinking about a little bit more is what are some of the other skill sets that of skill bridgers coming out here that could come in and add value across different aspects of our scaling operation. Because as an example, next year we're planning to launch 50 hospitals. It's a lot of logistics, it's a lot of coordination, it's a lot of to-dos, and you want to make sure that everything goes off without a hitch. That's a skill set that is imperative that we need to sprinkle in our organization as we grow. So if there's we'll go back and think about like a function like that as you highlighted. It's a great point.
Well, thank you, sir.
Great question, Keaton.
I was gonna say, great question, Keaton, and it's something that we talk about, like, and I know Andrew mentioned there a couple times in terms of like growth and scale is like you know, in terms of where we were 3.5 years ago, we're still a fairly small company though. So as we grow and our needs change and we learn more, it's something that I could see definitely something that we have to look at a little bit more. But great question.
Michael Jimenez.
Yes, sir. Hey, good morning. And first and foremost, thanks for having us. When I saw the brief regarding medical, it kind of opened up my eyes. So a little bit of background on me. I have 30 years of medical experience as an independent decorpment and also a respiratory therapist. I have clinical experience on both operationals and also in the military treatment facility. So two of my questions are, have you opened up this equipment to the military medicine? And my other question is there avenue that or have you thought about opening this equipment or device to any operational platforms such as naval ships? Because from my experience, and then when I saw what you're advertising, this is probably one of the devices that can help our our medical platforms to increase their warfighting readiness, just because of the possibility outcome that we may end up in the next couple of years.
The short answer is yes to both, and we're actively working with the Air Force and the Navy on advancing this technology for those use cases.
Yeah.
Mhm.
Okay. I'll look in your website and probably and hopefully that could, be a right fit in your organization. By the way, my last question, if you don't mind, do you have anything in the NCR, National Capital Region,
That's the DC?
DC area?
From a clinical clinical optimization specialist, I don't think we have an active opening. But yeah, I think, I mean, we're looking in all major geographies.
The short answer there would be yes, and it would just be potentially a matter of 3 months lead time.
Yeah, because you have because I work at Uniform Service University, currently the command master there, and we're a school of medicine, right? So this is probably one of the equipment that we could advertise, and I host a lot of these when during my time in command. And we have Bethesda, one of the biggest military treatment facility here, and not too far south, you have the Naval Hospital, Portsmouth, and also Fort Belvoir Army Hospital. That's all I have. Yeah, thank you.
No, Michael, thank you. Please do reach out to us. We have active collaborations with all of those places, and we're excited and keen. So we are on ECAT and available. We are in multiple VA facilities. So this technology is actually available to all those institutions that you highlighted. It's just a matter of getting it in their hands and training them up.
Okay. Thank you.
I didn't realize this, but my last name wasn't in my little bio picture there, so I just changed it. If you want to add to LinkedIn, be a great way to connect as well.
Okay, I'll connect with you, Ben.
Yeah.
Thanks, man.
One thing I wanted to mention as well is we actually have a pretty informative social media. If you go onto Instagram, for example, we have some good videos there for people that had asked about the technology, of people who are currently our clinical specialists who are demonstrating, on another team member demonstrating the FlowPatch and how some of the technology and physiology works. So it's a really great place to just get a quick little 30-second video of our tech.
Yeah. Yeah, because just a couple of months ago, I got connected companies, even all to the West Coast, Naval Medical Center, San Diego, all the way to up north, Pacific Northwest, and even down in Texas in BAMC. So
Cool.
yeah, this is probably something that I would love to do. All right, thank you, sir.
Yeah, Michael, I'd love to talk to you offline. If you want to connect with us, we'd love to have further discussions.
Sure, thank you.
I actually have a question. I know there probably will be more, but I normally ask a company like, what's a day in the life look like? But where you guys, I feel like a more representative question would be like, what's a month in the life look like as far as like when you're going to different places and stuff like that? I don't know if you can answer that.
I think every month is probably different, and it depends in which geography you work in. But essentially, the role is to be at the clinical optimization specialist is to be at your individual hospitals that you're responsible for on the floor, working with the RNs to ensure that they to provide them, peer-to-peer training, whether it's one-on-one or covering when shifts change over, so you can get a group of people to make sure that they understand how to apply the FlowPatch, how to find the FlowPatch, how to understand the metrics that are presented on the iPad with the spectrogram and what all of that means. And then be there to answer or support any ongoing questions, or if there's a challenge or an issue that pops up, to be there to answer those questions. I think that's really the essence of the job. Andrew, is there anything that I missed there?
Yeah, I think the fast-paced environment, and there's also kind of has been highlighted a continuum of kind of like where an account would start in terms of it being like a new account or a new hospital that's never heard of FlowPatch. So you're going in and being alongside the sales team, pitching, informing, demonstrating the technology early in the sales process, and then as it moves through the sales process, continuing to engage in key meetings and education sessions, and then ultimately, once a decision is made to move forward, leading the full implementation of that. So that it involves engaging with kind of all stakeholders that would be involved in bringing a new technology in the hospital: medical directors, nursing directors, nurse educators, sepsis coordinators, clinical informatics. It's a very, I would say, a very complex and long sale process, but it involves a ton of engagement. So it's fast paced, and it's a complex sale for a simple technology.
Yeah, I really appreciate the answer. And then forgive me if this one's already been asked, but is the FlowPatch, is it a one-time use? And then whether it is or isn't, how many would a hospital go through in, say, like a quarter or in a year? So is that part of the process of educating, is to get them to use more of them, right? Is that part of it?
Yeah, well, the most important part about a successful implementation is that we're more than just a technology. We're a technology-enabled workflow for caring for different types of patients. The main patient that we typically focus or target on are sepsis patients. These are patients that predominantly come in through the emergency department. And then there's a whole host of things that hospitals are mandated to do by the government through CMS to care for those patients. So integrating FlowPatch is part of what they do for those patients. We call that integration into the order set. Being part of that patient care pathway essentially means that every time one of those types of patients comes into the hospital, that FlowPatch is part of the dynamic assessments they perform as they care and resuscitate those patients. So the number of FlowPatches is directly proportional to the number of sepsis patients that a given hospital would see. That's just a function of patient volume. So, for example, some hospitals use 2,000 FlowPatches a year, others use 500, and it's just a matter of how many sepsis patients they see.
So it is one per patient, and then it gets discarded after that, or?
We actually run a reprocessing program. It's a sustainability program that we provide a rebate to the hospital. We collect the devices, and we actually clean, reprocess them, recertify them, and then they go out the door and just like a new device.
Wow.
So they're single patient use, reposable.
That's cool. Thomas Fleming. Thomas, did you have a question? Get your hand up. Sometimes we get an accidental hand up, but
Oh, that's good.
yeah. Does anybody else have any questions or anything?
Yeah, sorry. Sorry, I got low bandwidth over here on my side. So it took forever for it to process. My question is, my sister is a veterinarian. Large animals, small animals. She does surgeries across the board on everything. Is this something that with large animals, surgeries, and monitoring?
I'm not sure I caught the
I think that,
question
sorry,
there,
but I think I can answer that question is you know, it should be. There hasn't been any time spent with it using it in that. We've been focused on sepsis. Civilian market is the one that we're selling into and the one that we're targeted on. So the veterinarian market is certainly a peripheral market that could be of interest. It's just one that we haven't put any time or focus towards.
Interesting question. I hadn't even thought of that. Does anybody else have any questions for Andrew or Ben before we let them get back to saving lives? Great opportunity. If you have clinical experience, if you're close to what these guys are looking for, I would definitely recommend setting up a call with them. These guys they're on a powerful mission, and so if you think you have what it takes to be a part of that mission, definitely connect with them. The ways that you can do that are through LinkedIn. You can go to their website and apply to their jobs, or you can go directly to our job board and apply to the job. And then if you guys have any, if you have difficulties or questions with that, just knock out our end of day accountability form. It takes 30 seconds and we'll get your contact information over to them so that they can connect with you. So.
Awesome. I saw a lot of ones go in the chat there, so I'm hopeful we'll see some more applicants come through the portal. Or it's a really exciting, strong culture, really highly motivated people. For those of you transitioning into industry, working for a startup is probably the most fun you could have in your career. You're going to get a lifetime of experience in a short period working with highly motivated people that are focused on improving patient care. So if you want to come do that with us, that's you're joining a strong group of people that are highly motivated and no BS.
That's exactly, man, I love that you said that, Andrew, because that's exactly what we teach these folks is like, there's a lot of big companies out there, and I want everybody on here to apply to the big companies. But when you get ghosted by that big company, they don't respond to your application, they don't respond to your email, they're not answering the phone when you call. Startup companies are amazing places to go work. Like Andrew said, culture's normally great. Motivated people, there's a lot less red tape, a lot less bureaucracy, and it's a lot of fun. And it's a lot of fun working with groups like Flosonics. So really appreciate what you guys do. Karen, did you have a question by chance? Karen Hughes? Before I don't want to, you guys are welcome to stay as long as necessary. I just don't want to, I don't want to waste your time. So if we don't have any more questions, I want to be able to let you guys get back to it. So it's up to you, but.
So I see Jeffrey Winter there. Come up to Minnesota. We are actually launched in Fargo, North Dakota. So we are already up there.
That's awesome.
Great.
All right, thanks for having us today,
Thanks,
everyone. We
everybody.
look forward to continuing to engage with the program, and this will be an evergreen hiring bucket for us. So, Tyler, for as new people come into the program, please funnel them our way automatically right at the start.
Absolutely, and I'll be touching base with you here after this call. I really appreciate you guys. Ben, nice to meet you. I'm glad you were able to come in and join Andrew this time. But definitely looking forward to the pathways for great employment opportunities for our vets. So thank you for what you do.
Awesome.
Absolutely. Thanks,
everybody.
Our VP sales is West Point grad, so for what it's worth.
Dang. That is awesome. All right. Well, thank you guys. For the students,